Do any of you have any figures with regard to our SSI, SSP population? So we're talking about those who cannot work because of an infirmity or their age and are trying to survive on the very little that we give them. The purpose of the program is actually to sustain them, but it's fallen over the years to such a level that it's below the poverty line right now and certainly could never pay for any kind of housing in a tight housing market.
I mean,
do we know what percentage of those either currently homeless or at risk of homelessness because of the falling value of their SSI, SSP support?
I mean, certainly, for instance, in our study in Oakland, those who became newly homeless, many of them were on SSI, SSP. We used to think about there wasn't as much senior homelessness because it sort of cured homelessness. Well, in our housing markets in California, it no longer cures homelessness. And so certainly, I'm sorry I didn't bring the figures offhand, but a substantial proportion of our study of those who were homeless were receiving SSI, SSP, and were just not able to exit homelessness, and in fact entered homelessness on those. And so I think it's, you know, I don't have the exact numbers, but it is no longer really protective against homelessness in a way that half a generation ago it might have been.
I think if I could, I don't have the data, although we could certainly get it. I think that though that your comment about the income provided for somebody SSI plus the lack of housing stock, which we're experiencing here, probably not to the extent of the Bay Area, I think underscores another point that I think is really important, that that funding needs to be able to be flexible to allow for alternate living situations. You know, sometimes for those folks experiencing homelessness or living on a fixed income, the best outcome is not your own unit where you hold a lease. It might be doubling up with somebody, it might be returning to living with your sister or a friend. And looking at these and sometimes our funding sources are so restrictive about holding a lease, it makes it difficult to create those situations. So, you know, if we can have rapid rehousing programs that allow us to purposely create some partnerships and some new unique ways of living, it both preserves the affordability and lessens the impact on the need for new units.
Some of the most successful programs in the Bay Area have been shared housing programs that are using their rapid rehousing dollars to share housing units. And, you know, actually 2 or 3 of the best rapid rehousing providers in the country are in Alameda County and in San Francisco. And that's how we know that rapid rehousing works, because you're able to make it work in this incredibly typical housing market.
But we're certainly hearing a lot of our participants who stay a few nights a month with their family members, and when we ask why they don't stay longer, it's because of restrictions on their family member's lease, and they don't want to put that family member will take them in, but they don't want to jeopardize their housing.
And we know so much of the population in some of these housing short areas are already more than doubling, tripling, quadrupling up, many, many people living to a single room or small unit.
I think one thing we also say, at least we try to think about the homeless assistance system as ending homelessness, but we are not as well equipped to address poverty. You know, we're trying to end homelessness. These programs are crisis intervention programs to end people's homelessness. And we, of course, want to be able to address poverty and affordable housing issues. But, you know, these are the sort of resources and tools that we have. And that's why we're so focused on that piece.
Great, thank you. Senator Mitchell.
Thank you very much, Mr. Chairman. First for Ms., pronounce your last name for me?
Nagendra.
Nagendra, thank you very much. There was a op-ed in the Sacramento Bee recently that was focused on promoting a bill going through our legislature and promoting a local program, a local very successful housing program that I've toured that does drug testing. And the focus of the op-ed was to really suggest that the Housing First model has not been successful, and suggested that there was no evaluation suggesting that it was. I don't know if you happened to see that op-ed, but could you comment on that, on the theory that Housing First is not a tested model?
So I don't know the exact op-ed, but I know where that's coming from, because of course we hear that a lot. The permanent supportive housing model and the Housing First model has actually been around for over a decade, and there has been actually a lot of research, both in control group study research. The Journal of American Medicine has a study from a Seattle program that was for chronic inebriates on permanent supportive housing. there is a large amount of research that really shows the permanent supportive housing. I think it's the model we have the most research for, that shows, and just for Housing First, that it not only ends people's homelessness quickly, but it keeps them housed even when they are currently using, when they are experiencing mental health issues, co-occurring disorders, other multiple barriers. It just is more effective than the other model, which we had been using for a long time, which was transition, treatment readiness, housing readiness, and then put people in housing, which not only is more expensive, but actually wasn't producing outcomes to get people housed. The Housing First model is housing people at a much higher rate and keeping them housed at a much higher rate. And I am happy to sort of send you a mountain of literature around that if you would like.
I would appreciate
Yes,
that.
I would be happy to do that.
Thank you, and I'll share it. I appreciate your statement. Housing is the only thing that will end homelessness. I appreciate that and made note of it, and I'm going to quote you frequently as we go through this legislative session. But I was struck by, for the city of Sacramento, as you say, we spend a great deal of our time here, and just in the press today, the Sacramento Business Journal, there's an article where there's a Sacramento merchant organization that's opposing a Carol Liu bill that deals with urban camping, and the notion that if a city supports urban camping, that's not in the best interest of the city. And so while we've spent so much time talking about, housing capital and the lack thereof, how does Sacramento kind of handle that juxtaposition where they're opposing allowing people who are unhoused to have encampments when we acknowledge that there really aren't enough beds and spaces for them?
Right, yeah. So I think that, the city is trying to stay as focused as we can on solutions and keeping people connected to the system of care. And the more that that they are disconnected and camping out in areas of the city where they may not be making connections with service providers, or we have a police impact team who does proactive outreach. The longer they're going to spend on the streets, the worse their health is going to get, and frankly, the worse the impacts on our broader community. I think if we had resources for everything, we would certainly want to have sufficient shelter and housing and mental health care and, public health. But we're at a point where we have to make choices. And for us, the choice is always going to be housing, because it's the only thing that's going to end homelessness.
I think there's no question there, but we also are acknowledging that in all of our districts, we just don't have enough. So the issue is, until we get more, until we find funding sources, state level, county, cities, then what, and what are cities supposed to do? Also in today's press, it states that there are some, city council leaders here in Sacramento who will be traveling to Seattle to see Seattle's tent cities model. Can you enlighten us on that at all?
Yeah, I'm going as well. There's a whole bunch of us going up tomorrow. We were invited. There's a local organization here called Safe Ground who has been campaigning for years now on having legal encampments. It's different than the sort of right to rest, repeal the camping ordinance. It's more about having legal encampments. And they invited the city manager and some council members, the police department, myself, to Seattle because they have some legal encampments in the city, some which are sponsored and rotating through faith-based organizations, some which are on city land. They also have some state legislation which allows or doesn't prohibits communities from disallowing encampments on religious grounds. So it's a fact-finding mission. I think the city remains open to any solution. And while we're focused on housing, we do recognize there's a crisis in front of us, and we can't ignore that. So this is really our opportunity to learn from some other places who are doing this differently.
Mr. Ehrlich, thank you for being here and your patience. One thing that struck me by your testimony, you said that when you went to the TLCS presentation, you liked it, and so something resonated with you. I'm curious, what was it?
It was an outreach program, and it came to the Salvation Army. And they presented the case for people who were homeless and with psychiatric disabilities.
Got it.
And what they did is they offered, we'll get your life together, we'll get you into transitional living, and then while that one-year program in transitional living, we will find you permanent housing or some way to get you in permanent housing. But first we want to get you stabilized on your meds and seeing your psychiatrist on a normal level, getting your life skills back together first. And then they moved us into permanent housing, which I got Section 8 at that time, and it was actually was the last case for Section 8 that I got. Very lucky there. And I moved into an apartment in Midtown on 14th and P, and I lived there for 12 years and 10 months, and just recently moved into a senior living, which was a lot more nicer. But I believe because I got in this transitional living and an opportunity to get my life together and start going to regular meetings, seeing my doctor, getting stable on my meds, taking my meds stably, getting my life skills back together and prioritizing things. And then by the time I got to permanent housing, I was ready for it. So, and here I still am. I'm still doing this, and it's because I got the opportunity to work on these skills for 15 months before I moved into permanent housing. Now, I don't know if that's but it worked for me. It worked for me, and I know quite a few other people who it worked for, because you get this opportunity to redefine your life, and it keeps you motivated. And I think because of that, that's why I was able to be sober for 18 years, because being still associated with TLCS in the capacity of a member of the board, I'm still in touch with most of the staff and that, and so it's like they're my support team, and this is how I make it, and I just can't see ever quitting, although they said I only have 2 more terms left, so that's fine.
But you can always change a policy. Term limits can go away.
Yeah, we'll work on that.
Thank you for your willingness to share. One follow-up question, if I may. So I want to make sure I'm following you. So in transitional housing, you had the support. When you made your transition into your permanent supportive housing, did you still have TLCS as your network in some capacity?
I was still volunteering. I was still, matter of fact, I was doing 5 different programs for TLCS, as well as 3 others outside in our community.
So you were running programs. Were you still receiving support yourself?
Right.
Once you made your transition into permanent supportive housing?
Right. I was told, if you want to learn more about yourself and be a better person, teach it.
Yeah. Good point.
And so that's what I did, and and I embraced that. And so the bottom line is I become a burden in my community because of my drug conviction and stuff. And now I'm an asset in my community,
Yes, you are.
and that makes me feel good inside. So I have a lot of self-worth. I feel good about myself, and I want to continue this. And I believe we can help everybody out there that is homeless.
I couldn't agree with you more. Thank you for that. Last question, Mr. Chair, if I may. I was struck by the statistics you shared in responding to the chair's question. I want to make sure I'm following. What I heard you say is that it's about 10% in California of the homeless population that are chronic and in need of permanent supportive housing. So it's a small proportion of the overall homeless population, whereas rapid rehousing assistance, which is more cost-effective, shorter term, less intensive than all of the services that go along with permanent supportive housing, would support the vast majority.
That is correct, yes. And I think
And what's your source? What are you basing that on?
on both there was recently done a control study called the Housing Options Study, which HUD commissioned. It's about a 7-year study that did look at a few communities actually in California and sort of compared the costs of all interventions, permanent supportive housing, rapid rehousing, transitional housing, and emergency shelter. But there are a lot of sort of local community data that we also use. And the supportive services for veteran families, which is the huge federal investment in rapid rehousing and prevention resources, has rapidly rehoused about 110,000 households in the past 2 years. And so a lot of data, cost data, has been coming from them. And I do want to make a sort of a response, because I think Mr. Ehrlich's experience is so valuable.
Yes.
And that that transitional housing and those services that come with transitional housing are incredibly important.
Yes.
And it's not, these programs need those services, and they need to be flexible for people who need less services versus people who need much more intensive services.
Right.
But what we found in the cost is that, and I have some costs here, is that transitional housing, because you're often operating a facility,
Right.
costs something like $33,000 per family.
Right.
Shelter costs $17,000 per family. Rapid rehousing costs about $7,000 per family. And the services, though, are critical and can be sort of given once the person is in housing, brought to housing or happen on site. So it's really not about the services not being important. They are very important. It's just about when they happen.
Right. Thank you very much, Mr. Chair. Appreciate it.
Thank you, Senator Mitchell.
Thank you.
We have Senator Nielsen, then Senator Morlock, and then Senator Pan.
Well, you give me some hope that homelessness is not synonymous with hopeless. I spent several hours 3 Fridays ago walking around downtown Chico with a special team of the police force up there that are trying to do some things in Chico that are pretty encouraging. And they're starting with developing trust of the homeless population with the police, that they're their friends and they're to be assisting. Mr. Ehrlich, you certainly did give some signs of hope, and your response to the Senator's question, Senator Mitchell's question, sort of answered it. How have you been able to sustain your way through this? So many slide back. And it seems to me that the peer influence has been very helpful to you. The developing of self-confidence and the sustaining support has been very important. Is that pretty accurate?
Very much so. I had a desire to live a different life than my prior life. So the way I look at it is I'm blessed. I get to live 2 lifetimes in 1 lifetime. And so it's like I really look forward to being in this new sober life, being of service to my community. My community needs me, and that's important to me. And so, I enjoy being out there. My executive director for TLCS says I'm the ambassador for TLCS, and because that's what I do. I pound the streets. I look for people who's going to help support TLCS in our fundraisers and the homeless population. And to me, that's really critical. I have a 45-year-old son who's homeless. I can't get him into no programs or anything like that. So I have to deal with that as well. So, being a part of my community and supporting the homelessness and the mental health, it gives me that relief that I'm doing, because it hurts, to have my son out there and being homeless, and he doesn't want to help. He's got SSI, so his money goes to the bank. He's got a bank card, so he doesn't mind living out in the streets being homeless. Part of that population that I've experienced of homeless people is there's a percentage of them who checked out of society, and there's nothing you can do for them. And they don't want the help, no matter what. But there are those that are out there that need our help and want it, but don't know how to do it. I didn't know how to do it. But thank God I run into this outreach person who interested me in TLCS and how to get my life together. And that was the beginning. That was the start. I wouldn't change nothing how it happened thereafter. And I sure wouldn't change what happened in my prior life, because that is my strength today, is from that. And this is what I will continue to do until I can no longer be vertical and sucking air.
It is those who have checked out that perplex me so very much. And I've dealt with so very many of them. But one question additional then. Going back to in the beginning, because as I drive by every day, folks on the street corners or wherever they are, I can't help but look at them and I reflect on, there was a young child one day, and what happened? And I can't help but do that. And then as I drive by, I find some comfort in saying a prayer for them. I really do. In terms of society, in the beginning, what kind of things do we need to do as society to help in the beginning? Not a little later on when they get on the pathway, the things that we're talking about here today, but in the beginning.
I don't think there's no way to prevent homelessness from happening. A lot of it is like, I forgot her name, but she mentioned about the people being 50 years old and becoming homeless. Well, if society's failing by, you can't keep a home, you can't keep, your car payment, you can't feed your kid, how do you prevent that? What is prevention? That's what you have to look at. That's where it all starts at. But there's this, I'm telling you, there's probably a 30% in my own perception and what I've experienced out there as being homeless and talking to them. And they just flat checked out of society, period. It had nothing to do with, couldn't pay rent or anything. Laziness, I'm not sure. It's just they don't want to be part of society. So we have to, that's something that I think is going to be there forever. But there's that certain population, like in me, I needed help. I wanted help. And I looked for it. And that's how it works.
Well, as we mature, we have opportunities like you have to affect many. You mentor many. But sometimes I advise people when they're frustrated, and many times we have that, I tell them, well, go back to your community and one kid at a time.
Yeah.
Adopt one kid at a time and mentor. Now, I don't necessarily mean just one kid at a time. You can, but focus on a population that's manageable for you. Don't try to take on the whole thing. It's too much. One kid at a time. Focus on one kid at a time. But we all can do our small part, small but not inconsequent. But thank you for your inspiration, your mission, and your purpose, because you are making a difference, sir.
Thank you. I appreciate that.
Thank you, Senator Nielsen. Senator Morlock.
Thank you, Mr. Chair. Just a few quick questions, if I could. Ms.
Nagendra, yeah.
In your presentation, I wanted to say that I heard a lot, but I didn't hear a few things, and I just want to ask about, I had the privilege as a county supervisor to be the initial chairman of the Commission to End Homelessness, and we worked on 10-year plans to end homelessness. How is that going around this state? How many counties are doing plans, and how many major metropolitan areas?
Many communities around the state have plans to end homelessness. I've also helped draft some plans to end homelessness in the Bay Area. And there are, I think, I think when the plan to end homelessness, that vision that actually I think was originated by the Alliance in early 2000, it was really the sort of shift from, we have to think about this in a more system-wide approach. We need the right partners at the table. It can't be sort of just the providers or the nonprofit community or just one agency, county agency or city agency that's focusing on it. So the 10-year plan is really meant to be a strategic vision of looking at all the different pieces, prevention, the front door, the back door, and all the pieces that need to come together to make that happen. I think that there are communities in California that have made a lot of progress. For example, Long Beach, California is, I think, one of the first communities in California to end veteran homelessness, and they also had a long strategic plan. They had a lot of they had their resources come together well around veterans, of course, but they have been advancing their strategic plan to end homelessness. Well, I think a lot of communities like Alameda County, San Francisco are sort of towards the end of their first 10 years. And there have been a lot of system-wide changes, I think. I think we would all, in all of the communities we've worked in, the system approach is definitely one that has taken hold. Santa Clara County is a really good example of that as well. And I think that in terms of how's it working, I think it's different from community to community. Sacramento, I know you also just did your strategic plan to end homelessness. I don't know if you want to comment on this.
So we have a 10-year plan that's back from, I think, 2005 or 2006. And, I think that it was effective in getting a lot of the people at the table at the time. What Cynthia is referring to is Sacramento steps forward, leading the county, created a strategic action plan, somewhat trying to take some of those concepts and ideas that were born in the 10-year plan and really make them, bring them out into actions and to align them with some of the new opportunities we've had. Now we in Sacramento, our continuum of care used to fall under the county. Now it's been pulled out to this nonprofit, which really gives us more opportunities. So, as far as our 10-year plan, it was definitely an important step along the way, but I think we've come a long ways here locally.
And I think it has just, the 10-year plans have brought many more partners to the table, mainstream agencies that were never at the table before, and kind of created a much sort of more complex response to the issues that were really not being kind of we didn't have the partners at the table 10 years ago that we do now. And I think those 10-year plans have been effective in doing that.
Well, one of the things I discovered is that the federal level of government seems to be missing the mark when you talk about continuum of care and NOFA and HUD, all missing the mark in some unique way. It's almost as if they built a train line and they're just a mile away from the station. It's just kind of an irritating thing. And so we've had to redirect continuum of care to nonprofits that actually help homeless instead of just always renewing last year's program. So I'm just sort of wondering how that's going here. You have your point in time, you have your homeless counts, you have your management information systems. Is everyone coordinating, and is someone in DC still keeping track of all this data?
Well, I can't, I'm not going to defend HUD, but I will say that, the data collection around the country has improved a lot, and that data is definitely being used to sort of implement a much more performance-based approach. As you're saying, I think the federal government wanted to see outcomes instead of sort of just renewing programs for delivering services. We wanted to see our communities really ending homelessness. Are they really reducing the length of homelessness? So the data that they're asking communities to collect is to now show those system-wide outcomes, not just the program-level outcomes. The data quality still needs to improve because you still have programs entering data, but that is sort of where the data is, how it's being analyzed and how it's being used, and how it's being used to refund communities, because there are communities who are losing money because they're not showing those performance levels.
Well, one thing that pops out is the rapid rehousing is really critical, but Senator Mitchell already quoted from the Business Journal, but there was an article 2 weeks ago as well, and it just mentioned an organization called Cottage Housing. Just one line, about half the residents at Cottage prefer to sit in their rooms and drink all day. Could you comment on that?
I hadn't seen that article. I'm very familiar with Cottage Housing as an organization. I'm surprised. It's a permanent supportive housing program. I'm assuming it's talking about Quinn Cottages. Is that the program it's talking about?
It's a nonprofit that provides over 300 beds at 2 centers in Sacramento.
Mm-hmm, yeah. I think that if it's the program I'm guessing they're talking about, it's a permanent supportive housing, so it's somebody's house. And so what you do, I think that's sort of one of the underpinnings of Housing First is that you move into housing, and if you know, Mr. Ehrlich is a great example, somebody who really chose to take all the resources and to change his life. Some people don't. I mean, we all know people who are housed and have never become homeless who drink, or who are addicted to drugs, or who have uncontrolled mental health. And we want them to make changes as well. I think that programs like cottage housing and other permanent supportive housing offer the option, but they don't force the option. They don't condition your tenancy. And, you know, eventually, you know, like where Mr. Ehrlich came to is hopefully the person makes that choice. But as Cynthia said, you know, the homeless system of care can't bear the brunt of being the anti-poverty organization, the mental health organization. Those things have to come alongside. So I didn't see that article. I'll have to look it up, but.
It's dated February 5. You have an organization called St. John's in Sacramento, and it seems to be rather successful. But Senator Mitchell referred to it earlier. Do they have drug testing or any of that there, and how does that work with your program?